How much can you truly care about someone you don't know? Many of us say we value human life, but our actions don't always line up. Our emotions seem to have a capacity, and when we hit that limit, we suddenly stop caring altogether. This phenomenon can be summarized by the saying, one death is a tragedy, a million deaths is a statistic.
It reflects the fact that we respond very strongly to a single person in distress. We are emotionally moved by the plight of an individual, and we'll do a lot to help that person, to rescue them, to protect them. And on the other hand, when we see statistics of large numbers of people endangered, we can't relate in the same way. They don't convey the emotion or the feeling. They're just numbers.
That's Dr. Paul Slovic, professor of psychology at the University of Oregon and president of the research institute called Decision Research. He says our limited emotional capacity is due to an idea called the Arithmetic of Compassion. It's made up of three foundational concepts: psychic numbing, pseudo-inefficacy, and the Prominence Effect. All three can trick our minds and influence our actions. For example, psychic numbing keeps us from getting overwhelmed and unable to function in tragic situations.
The word itself was coined by a psychiatrist named Robert J. Lifton, who observed after the nuclear weapons bombings in Japan were in World War II that the aid workers, the people who went in there to try to help any people who were still alive, had to kind of overcome their feelings to be able to function in such a horrific environment.
The psychological phenomenon causes us to feel indifferent to mass tragedies. Slovic thinks this mechanism has helped humans survive throughout history, but says there's a downside to this protection.
As the number of people at risk increase, we can't focus on them as individuals, and so we lose an element of their humanity. We get the data. It's so important. The data is critical, but the data comes to us as numbers and statistics. Someone once said that statistics are human beings with the tears dried off. Well, we need tears to catch our attention to a problem and to motivate us to act. And if information isn't creating some tears or emotional tears in us, then we don't really appreciate its meaning and we don't respond appropriately.
And unfortunately, there's no exact number that tells us we've reached full emotional capacity. Depending on the circumstance, we can become numb to 50 people dying or just 2.
We find that a single life, is most important to us. And let's say that there are 2 people. If you are told that there are 2 people in danger and you get information about them, you probably won't feel twice as concerned as you feel about one, because you're likely to feel strongly concerned about one, and our feelings have a limit, have a ceiling. You may feel a bit more concerned, but probably not twice as concerned. And so no wonder when we're talking about tens of thousands or hundreds of thousands or millions of people, we can't feel the reality there.
But Slovic says there are ways to break through psychic numbing. Sometimes even one picture can help us separate human lives from statistics, like in 2015 during the Syrian civil war. A little boy was photographed face down on a beach after he drowned trying to escape.
So that picture had a galvanizing effect on people who had not been concerned about the war in Syria or about the millions of refugees that war created. It had been going on for 4 years, and 250,000 people had died in the conflict against the Syrian government. And there was very little interest. And then overnight, that picture surfaced and was spread around the world and changed. People took notice and they started looking up for information about refugees and about Syrian war.
In fact, the Swedish government's refugee program showed a drastic increase in donations after that image went viral.
That fund was perking along at about $8,000 a day prior to that picture. And then the next day after the picture surfaced, it went from $8,000 to $430,000. So, a huge difference because of that photograph. The statistics of 250,000 deaths, again, didn't have any impact on people. The photograph did.
But we can't always rely on a picture to wake us up. The little boy was just one of thousands of images shared to the public. And though this one picture made an impact, Slovic says that seeing so many photos of a tragedy usually leads to more numbing. But if we value human life, why do we so often turn a blind eye to horrific situations? In order to find the answer, Slovic began researching what motivated people to donate to those in need.
So we did an experiment where we showed people information about a child in Africa who was facing starvation. And we showed a picture of her, we showed her name and her age and where she came from. And about half the people in our experiment donated some money to this cause for children like her. And then we thought, well, that's half the people, but what about the other half? Maybe we could get more people to donate and to donate more money if we told them how big a problem starvation was in her region.
So he ran the same experiment, only this time he added statistics to the millions of others who were also starving.
And what we found was it had the opposite effect. The donations dropped in half when they saw the statistics. And then when we after we recovered from our surprise, started to try to figure it out, we sort of realized that, well, maybe it's because two things. One is that we know that people donate to help others, first because others need our help, and second, we feel good about helping them.
Slovic calls this the warm glow of satisfaction.
And what we thought might be happening was that the good feeling we had about donating on behalf of children like this little girl was dampened and reduced by the bad feelings we had when we realized that there were millions of children we weren't helping.
After another round of research, Slovic discovered that when people see everyone they're unable to help, bad feelings mingle with and affect the positive ones.
So then it doesn't feel as good to help this child when you realize that there's many you're not helping. So you don't even help the child you can help.
Which is the second branch of the arithmetic of compassion, called pseudo-inefficacy, meaning a false sense of helplessness. When faced with all the people you can't help, you feel as though you won't be able to make any difference, and therefore you don't help at all. In order for Slovic to prove pseudo-inefficacy, he conducted a study that asked people to donate to a charity on behalf of a little boy. Next to the boy's image, he included 5 unrelated pictures that have been proven to convey negative feelings.
A picture of a handgun pointing at you, a picture of a snarling dog. And they work the same way as the kids you couldn't help. That is, the negative feelings that they created made you feel less good about helping the child. And the more negative you found those irrelevant feelings, the less good you felt about helping the child. Completely irrelevant information that your brain let in, and it messed you up. It deceived you.
But Slovic says we need to fight this feeling.
Just because you can't solve a whole problem doesn't mean that you can't do something important. And we use the saying, even partial solutions can save whole lives.
And while both pseudo-inefficacy and psychic numbing are ways that our feelings deceive us, the third part of the arithmetic of compassion isn't as emotional.
The prominence effect is a situation in which we're thinking more carefully and slowly and coming up with reasons for our decisions. And we still are acting in a way that is maybe contradicts our values. Why is it that nations that are based on principles of, helping people, kind of high moral principles, turn a blind eye when genocide is being committed in other nations? It happens all the time. It's happened since World War II and the Holocaust. We said the Holocaust is horrible. What happened there? Never again.
Unfortunately, that promise of never again hasn't been kept. There continues to be genocide and mass killings to this day, and Slovic sought to understand why there's rarely outside intervention. His research led back to the prominence effect.
And what we found is that in situations in which one's attention is called to atrocities that you feel should not be allowed to happen, there are costs for intervening.
If a nation decides to invade another that's killing its citizens, Slovic says that choice can be expensive, dangerous, and risk angering political allies.
And so you have to weigh these costs, all related in some way to our security, with the costs of allowing these people to die if we don't intervene. And no matter how much we say we value their lives, when it comes to choosing, the choice is tipped in the direction of our security, and we turn our backs.
Which is why Slovic says the arithmetic of compassion is deadly. It's not rational, and it can influence to act against our own values. He says we need to be aware of these mechanisms happening inside our minds in order to counteract them.
If we understood this, maybe there are ways we can act so we can act more consistent with the high values we place on individual lives in situations where there are many individuals at risk, where we can be consistent in valuing life.
Slovic offers a complete breakdown of these three principles, psychic numbing, pseudo-inefficacy, and the prominence effect, on his website, arithmeticofcompassion.org. You can find more information about Dr. Paul Slovic and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence. Coming up next week on Radio Health Journal.
Those who might most benefit from it are sometimes the ones who are most challenged to use a resource like that.
Why online pharmacies aren't the perfect solution for pharmacy deserts.
Then the disease that affects millions who don't even know they have it.
We know that this condition, as I've outlined, is associated with enormous morbidity and mortality risk. As I've said, it's a pandemic in itself. It's a big public health problem.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
We need to be doing a heck of a lot of both of these things if we want to really create a world where we aren't constantly plagued by escalating climate disasters.
The escalating weather extremes across the globe. Then,
ASMR, mukbang, these are sort of these trends that certainly no one inside YouTube was trying to make huge, but they just went in that direction that the company didn't really predict.
The evolution of YouTube. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.